Hi everyone, my name is Monica Paudel. This is my final reflective video journal for this semester. During this clinical course, I completed my pediatric and adolescents mental health clinical rotation. This experience helped me to grow personally and professionally while strengthening my understanding of psychiatric mental health nurse practitioner role. At the beginning of the semester, I set several goals for myself. I want to improve my confidence in psychiatric interviewing, therapeutic communication, and performing the mental health assessment with the children and adolescents. I also want to become more comfortable communicating with the parents and caregiver and learn how to provide compassionate patient-centered care for young patients experiencing anxiety, depression, ADHD, trauma, and behavior disorder. Looking back, I believe I achieved many of the goals. At the beginning, I felt nervous interviewing pediatric patients because children and adolescents often experience emotional difficulty than adults. Some patients were shy, anxious, distracted, and unwilling to talk openly. Over the time, I learned how important patient trust building and age-appropriate communication are in mental health care. I become more confident conducting psychiatric assessment, building therapeutic relationship with both patient and family. During my clinical experience, I experienced feeling of anxiety, sadness, and self-doubt. Hearing children discuss trauma, bullying, depression, family conflict, emotional struggle was sometimes emotionally difficult. I realized I had some assumption about how family stress, social media, and social pressure and unstable home environment affect children's mental health. Through clinical experience and reflection, I learned to approach every patient without judgment, with greater empathy and understanding. I manage my anxiety and uncertainty by preparing before clinical, reviewing DSM-5 criteria and pharmacotherapy, asking questions, and seeking feedback from my preceptor. I remember myself that learning takes time and it is important not to know everything immediately. As the semester progressed, my confidence and communication skill improved significantly. One of the biggest insight I gained was understanding how important early mental health intervention for the children and adolescents. I learned that mental health condition can affect school performance, relationship, self-esteem, and long-term emotional well-being. I also realized how important family involvement in the pediatric mental health treatment and how therapeutic communication can help children feel safe, heard, and support. Reflective practice had a major impact on me as a person, student, and for the provider. It helped me to become more self-aware, emotionally sensitive, and mindful of my communication reaction. I discovered strengths such as remaining calm, compassionate, empathetic during difficult situations help a lot. At the same time, I recognize limitations such as being overly self-critical and sometimes doubting myself. I definitely I definitely plan to continue using reflection in my further practice as a psychiatric mental health nurse practitioner. Reflection helps improve patient care, communication, self-awareness, professional growth. It also it it will also help me to manage stress, continue learning, and provide more compassionate and effective mental health care to future patients and families. Overall, this pediatric and adolescent mental health clinical experience was one of the most meaningful part of my psychiatric mental health nurse practitioner program. It strengthened my confidence, empathy, communication skill, understanding of mental health care. Most importantly, it reinforced the importance of compassion, patience, and therapeutic relationship in a psychiatric nurse practice. It was a very wonderful and insightful experience for me as a as personally and professionally, and I would look forward to apply this experience in a future practice. Thank you so much, my professors and my preceptor, for providing me opportunity to learn and grow in this semester. I look forward to apply this theory and clinical knowledge in my future practice. Thank you.